my name is Veronica Gallegos, and I'm a graduate student from Benedictine University. Today I will be proposing a comprehensive workplace violence, bullying, and hostility prevention program for the Labor and Delivery Unit of an acute care organization in the state of Texas. The Labor and Delivery Unit of this acute care organization has been encountering acts of bullying and hostility among the nursing professionals. These actions necessitate immediate attention and require collaboration from all leadership within the maternal child health department in transforming the climate. These acts of bullying and hostility among the nursing professionals of the L&D unit are in the forms of threats, criticism, blaming, gossiping, passive aggression, intimidation, embarrassment, and reframing of team communication. These actions of bullying are causing misinterpretation and reframing of receiving crucial information that is pertinent to the patient's health and safety. Additionally, this problem has caused delays in patient care, healthcare services, and jeopardizing staff well-being. The nursing professionals of the Labor and Delivery Unit are not abiding by the Code of Ethics for Nurses. Provision 1, 2, and 3 of the Code of Ethics for Nurses emphasizes the significance of refraining from acts of incivility, importance of team collaboration, and accountability in addressing impaired practices. The Healthcare Workplace Violence Prevention Act mandates the Federal Occupational Safety and Health Administration implement a national comprehensive and unit-specific workplace violence prevention plan for healthcare organizations. A nurse-developed comprehensive workplace bullying and hostility prevention program affiliated with safety and federal health guidelines is proposed and intended to result in improved interprofessional collaboration, communication, patient and employee safety, and promote a culture of civility and respect. The literature reviewed was consistent and had no gaps. The level of evidence of the research studies were all considered to be a level 6. Each research study recommended further research to be completed by recommending mitigation strategies in tackling bullying in the nursing profession. Those strategies recommended in each study were interventions in conflict resolution, emotional intelligence, and cognitive rehearsal, to include the initiation of an anti-bullying policy. The Joint Commission demands acts of unprofessionalism to be discontinued. The project's framework is based on a developed conceptual framework. This conceptual framework is known as violence in the workplace. The framework consists of 3 domains. These 3 domains are organizational dynamics, behavior, and adverse effects of bullying on targets. The organizational dynamics consist of leadership transitioning every 2 to 3 years, leader styles, and the system used for incentives. Behaviors of the nursing professionals have caused continuous destructive environments during times of high stress, to include tenured employees clustering and resisting all forms of change through acts of bullying. Furthermore, adverse effects cause stress, illnesses, fluctuation in behaviors, and reduce quality care delivered to the community served. A SWOT analysis will focus on positive and negative aspects, or internal and external factors of change. Strengths of the internal factors are having civilian employees and position leaders that are engaged in transforming the climate of the organization, following expectations of federal and safety regulations, and mandatory training and conflict resolution for all staff. The opportunities and threats consist of having new employees and leaders transitioning every 2 to 3 years. The PDSA method and conceptual framework will be used in guidance of the proposed project. The project setting is a labor and delivery unit of an acute care organization. The acute care organization is in the state of Texas and is part of the armed forces. The objective of the project is to develop a culture of trust, respect, accountability, and professionalism in mitigating acts of hostility and bullying among the nursing professionals of the labor and delivery unit. The implementation of the evidence-based violence prevention program will engage all administrative, leadership, and frontline staff to collaborate and gain skills in conflict resolution, emotional intelligence, and cognitive rehearsal, which will then lead to the implementation of an anti-bullying policy. Training and education in conflict resolution, emotional intelligence, and cognitive rehearsal is to be provided in a 2-day training. Conflict resolution will allow an outward mindset through the adoption of self-reflection and open mindset of others and their views. Emotional intelligence provides nursing staff skills in responding to personal emotions, and cognitive rehearsal allows the ability to role play and develop confidence and empowerment to professionally confront acts of incivility. The organization's mission is to provide safe, high-quality care and promote a safe, supportive environment of care to the community served. The project's motive is congruent to the mission and vision of the organization. Currently, nursing staff within the LMD unit have been experiencing an upsurge in acts of incivility and bullying amongst each other. The healthcare setting for the project is explicit to the organization's Women's Health Service line that is among many other service lines that are part of the Armed Forces Medicine. Key stakeholders fit for the proposed change are the organizational executive leadership personnel, which is also known as the commander of the organization, chief financial officer, civilian human resource personnel, nursing leadership or administrative personnel, nursing educators, also known as the clinical nurse specialists in the organization, unit practice council members, and the union representatives. Setting a budget for the implementation of the proposed change was based on strategic planning. Direct and indirect costs were considered in planning, implementing, and evaluating the project. Direct and indirect costs associated with the planning, implementation, and evaluation of the project was based on the current fiscal year's budget. The total cost for the project is estimated at $86,980. The cost associated with the implementation of the proposed change benefits the organization toward the climate change and investing in the department's future success. The collection of data will be obtained with the use of the PDSA method. During a pilot study, the collection of information will be based on the gathered data obtained through a systematic direct observation tool. This tool will provide data and nursing staff implementing and utilizing skills gained in conflict resolution, emotional intelligence, and cognitive rehearsal. Tracers will be provided with an observation behavioral audit tool in efforts of gathering reliable data on staff members' behaviors. Outcomes to be achieved are awareness and accountability of bullying and hostility, effective communication, collaboration, and improved team dynamics to include reduced hostility and bullying. This evidence-based proposal received ample support from key stakeholders of the Maternal Child Health Department. The need for the implementation and timeframe of the project's implementation was discussed, to include the enforcement of an anti-bullying policy. Recommendations were received to present this proposal to the Chief Executive Officer of the organization in hopes of receiving buy-in and implementing the project throughout the organization. Moving the project forward requires buy-in from the commander of the organization. Currently, the organization is in the process of training all staff members in conflict resolution and is in the process of change management. The project will be presented to the commander and certified nurse specialist of the organization for buy-in and guidance in implementing the project. Implementation of change management requires patience, consistency, motivation, and collaboration. Collaboration and communication is essential to patient safety and quality care delivered. Organizational culture is dependent on accountability and leadership style. Factors that decrease bullying are the development of trusting and civil cultures. Ladies and gentlemen, it is time for the nursing professionals to come together and help mitigate bullying in the nursing profession. It is time for change.